Oh, sure. That's not very helpful, is it? There we go.
How does the room have its hand up? That is just mostly the part. Yeah, there you go. All right, the recording's gone.
Okay, great. Hi, everyone. I'm Wendy Hinman. I remain the Vice President of the Board of Health until next month, but I am standing in for Morgan, who I think may be joining us later in the meeting, but has asked me to take the meeting. I'm calling to order the Boulder County Board of Health regular meeting. It is September 8th, and I believe it's 5:31. As we get started, I would like to have all of my other board members introduce themselves, and then we are going to take the time to go around the room and have all the staff in the room introduce themselves as well for the benefit of our newest board member who we'll be introducing in a little bit. So Amber, do you want to go ahead?
Sure, Amber Johnson, board member.
Oh, I'm former Brooke Harrison, former board member.
As an honorary, forever board member. And Steve, would you like to go as well?
Oh, sure.
Yeah.
Stephen Yoon, I guess I'm the newest board member.
That's right. Thank you
Happy
for
to be
being
here.
here.
We have Landry on the screen.
Oh, and Landry's here. Thank you, Landry.
I'm sorry for not being there. I had a low-grade fever today, so I didn't want to make you sick, but it's good to meet you at least remotely.
Landry, we very much appreciate that. So I will note that we do have a quorum present. The notice of this meeting was posted on the Board of Health website, and the call-in information and address was also included for public participation. So now that we know we have quorum, maybe we can start with Kelly and go around the room for introduction.
Sure. Hi, everyone. My name is Kelly Hinch. I use she, her pronouns. I'm the Strategic Initiatives Director. Anything else you want us to say, Lindy, or?
No, I think just titles and intros at this point, yes. And Steve can ask more questions later.
You guys welcome.
Hi, Lexi Nolan. I'm the executive director and I use she, her pronouns.
Wanda Wandila, Director of Administration and Finance.
It's Marie Kazarosian. I'm the finance manager and I use she, her pronouns.
Indira Kushral, I use she, her pronouns, and I'm the deputy director.
And I just met you.
Deputy Baron, I am the division manager for communicable disease and emergency management, and I use she, hers.
Nice to see you again. Elise Wong, and I use she, her pronouns. I'm the health planning and evaluation program manager.
Hi there, I'm Eleanor Sidman. I'm the monitoring and evaluation specialist within the health planning team. Quite a mouthful. And I use she, her pronouns.
My name is Rachel Lintel. I use she, her pronouns. I'm the health planner in the health planning and evaluation team.
Hi, Daphne McCabe, family health division manager. And I use she.
I'm Tessa Hale. I use she, her pronouns, and I'm the policy and systems change analyst.
Hi, Rachel Arndt, environmental health division manager, and the issue pronouns.
Patrick Cannell, he, him, Executive Administrative Assistant.
Dalia Mohammed, she, her, and I am the admin specialist of the strategic initiatives branch.
Okay, well, thanks everyone for being here tonight and welcoming our new board member.
We do have a couple of people.
Thank you. On the phone. Thanks, Lexi.
Keith and Sarah, do you guys want to pop in? You don't have to.
Hello, hi everyone. I'm Keith Rawls. I use pronouns he, him, his. I'm the immunization program coordinator. Thank you.
Hi, I'm Sarah DeVore. It wasn't letting me unmute. I'm Sarah DeVore. I'm the senior budget analyst.
Okay,
Thank you.
Patrick, just to confirm, are there any members of the public that would like to be speaking to us tonight for public?
No, we didn't have any signups for tonight.
Okay, great. All right, well, with that, then I think we'll move into the rest of the agenda. So just to go over it briefly, we are going to have some welcomes and appreciation for our exiting board member, Brooke. We're going to talk about the strategic plan and key performance indicators. We are also going to talk about a potential strategic planning subcommittee and the merits of that from the board. And then finally, we will go over the director's report and any questions that the board or staff have for the board related to that. I'll pause there. Anything else to add to the agenda, Lexi, or team, before we get going? Okay, great. Lexi, I'll turn it over to you for.
All right, well, thank you very much, and appreciate everybody being here tonight. It is a light agenda. Now that we have a high-level budget, we are busy scurrying away at putting all of the pieces together. So appreciate letting us take a little bit of a breath. And a few things to celebrate tonight. First of all, we are welcoming Tessa Hale as our Senior Policy and Systems Change Analyst. I will tell you that this position had, what was it, 93 applicants, Indira?
I think it was more.
More?
That's what screened through to us.
Yeah, and it was a rigorous hiring process. And I will tell you that we had so many people comment on how excited the job description was, because it wasn't kind of a normal kind of, we expect you to, advise us on policy. It was much more of an engaged role. A lot of the work that Tessa will be doing with us is really around how do we create change at the local level, not only through policy, which might be through, working with municipalities, but also through how do we work with our partners to really embed preventive health work in our community institutions. And that's really exciting, and also a fantastic complement to the kind of community engagement work that we want to do, which also has a strong focus on our nonprofit partners. So we see this as part of our agency vision for how we really begin to build those relationships and leverage in ways that we haven't been able to for the last few years. And I personally am extremely excited about this position. I've been advocating for it for about 4 years now. So welcome, Tessa. Tessa also was previously with us. She was part of the HEAL, the Healthy Eating Active Living team at Boulder County Public Health. And she and I worked together on COVID policy at that point. And so we're delighted to have you back with us and really looking forward to it.
Thank you. I'm so excited to be here. It's great to return to Boulder County Public Health and the amazing work that's happening here. It's such a stellar local public health agency. And as everyone knows, there's an immense amount of work that needs to be done urgently. So I look forward to collaborating across the agency and maybe even pulling in the board for some support with testimony and those kinds of things in the future.
Great, thank you. Okay, next up, we have Megan Gatos we have retained her as an hourly position through the end of the year to help us build out our community engagement vision, infrastructure, architecture, identify what our resource needs would be, and really to help us to kind of scope the work to the resources that we can reasonably manage. You may know that the county has a community engagement initiative underway, and so our work has been very aligned with theirs, and we want to keep it that way. And, public health is just such a natural space for community engagement. It requires community engagement to be effective. And our programs, most of you probably know that our programs do an enormous amount of community engagement already. And they all do it in their own particular ways. And really what this is about developing an agency vision for this work and some common tools and some infrastructure to support people. I remember one time someone told me, might have been you, Stephanie, somebody, a public health person was walking out of someone's office and a community services person was walking into someone's office, and they kind of looked at each other and said, "Oh, I didn't know you worked with this person." And it was indicative of, the county is so big. And when the public sees somebody from the county, they think we must know each other and work together all the time because we're all part of the county, right? And so this is really also, we hope, will help us, give us kind of the systems to really be able to be effective in our engagements and not quite so sporadic, and to really think intentionally about how deep our engagement level is with different kinds of partners for different projects. So we're really excited to have Megan with us. Megan comes from Health Impact Partners, and she was with CalPO immediately before. When she was with Health Impact Partners, she did a lot of work on helping public health departments to set up community engagement work. She has really deep knowledge nationally in this space, and we're delighted to have her with us. She's not with us tonight, but we are delighted to host her for the rest of the year in this role.
Great. And I'm just, like she just say, I'm excited about this concept of better partnership engagement, even within the county. That's fantastic. Yeah,
We're looking forward to it.
Yeah.
And finally, welcoming Steve Yoon. Steve has remarkable experience at CDC and with the U.S. Public Health Service. We were really excited to see his application for the board. He has a lot of experience in infectious disease, working internationally in data systems. And we're looking forward to seeing some of the special areas where you might collaborate with us and add to the strength of our board. And we're just really excited to have you on board.
Thank you. I look forward to working with everybody. When I left CDC, I thought my public health career was over. I was going to enjoy skiing and so on. But when I saw the announcement, I was very excited about an opportunity to do it. And I said, let's see if I can help. So I look forward to working with everybody.
It's your ski mountain.
Oh gosh, less traffic the better. So Eldora is anyways.
Well, welcome. We're all thrilled to have you here, and your expertise speaks for itself. So thrilled. Well, I have the duty of thanking Brooke Harrison for her service to the board for 5 years. I am very sad to see Brooke go personally, and I think all board members that have worked with Brooke feel the same way. But we are so grateful for the time you've given this organization. You've shown incredible leadership. Your commitment to public health and the county has, you've put in a lot more, Brooke, than probably you knew you were going to need to do during that time. So happy that you stepped up to the challenge. I did want to recognize some things that I personally feel that Brooke brought to the table. I think the first is you really championed what I'm going to call performance transparency for the organization. I think we've had a pretty significant cultural shift in the time that you've been on the board in terms of what the board expects, but also what the organization expects and the community expects. So that has been an incredible mark, and thank you for all of that work, and it's ongoing. I think related to that, your support around the budget, the recent budget conversations, and really helping to lead through those conversations from the board perspective has been incredibly impactful, and just wanted to say thank you for all of that work. And I think the other thing I'll mention about Brooke is that you really elevate the conversation through strategic questions. Every time you ask a question, I lean in and listen a little harder because I know it's something really important. So thank you for focusing on this organization, giving everything to this organization for 5 years, and ensuring that we are on a sustainable path for the long haul. We couldn't have done it without you, truly. So thank you, Brooke, for all of your time and effort and energy. Of course.
Thank you all. It has been a wild 5 say. But the change that I've seen in the department in 5 years is just unbelievable. And I think that the department's I think you're in a good spot. I think there's a lot of stability in the department now that's really coming into fruition now. And so I think that's great. And I'm very sad to go, but I could still serve 5 more years. So maybe I'll be back later. But thank you, everyone. It's been an amazing experience.
And we do have a commemorative framed letter for you, but Morgan's not here tonight, so we're gonna get her signature and we'll drop it off.
Oh, perfect. Excellent.
And
And
now
now
we'll
we'll take the name tag tonight.
Oh, I'm going to. And now I'll just call in for open comment.
Every time, Brett.
Thank you.
We'll miss
Thank
you, Brooke. It's been great.
Thank
Thank you.
I just want to say, like, you started in 2020, August, like in the middle of the pandemic.
Yes,
And you
we
want to come back? That shows what a representative.
It's been ups and downs, but to be honest, like I've enjoyed it. Like I learned a lot going.
With that, I think we will move to approving the August meeting minutes. I make a motion to approve the meeting minutes from August 11th, 2025. And I would like somebody on the board to second that motion.
Second.
Thank you, Amber. All in favor, say aye. Aye. Andrew?
That was a quick one.
Thank you, Andrew. All right, motion approved. The minutes are approved for August 11th, 2025. From there, I think we will now move into the agenda. And Lexi, I'll turn it over to you.
Well, I'm gonna kick it right over to Kelly.
Hi, Brooke.
Bye, Brooke. Let me introduce you.
Yeah. Of course. So with us tonight, from a health planning evaluation team, we have Elise Wong, she introduced herself, she's the HBE manager. We have Eleanor, and who is part of our evaluator, and we have Rachel, who is our health planner. So Rachel and Eleanor are going to be giving a presentation. We're going to talk about our strategic plan work and some of the KPIs and such, and some of the steps to move forward in that space, right? I know that there are some pocket slides beyond what we're going to be presenting today that were, I think, really helpful. And we had a good opportunity to meet with Morgan and Lindy Thursday, Friday, something like that. Yep. And so we're looking forward to moving the space forward because it's a big cultural shift. The agency has really never done this sort of more agency level data and evaluation work before, right? And being able to better use data or collect good data that allows us to make the right decisions, connect that with all the budget work we've done over the last year. And I think we're coming back next month too, to talk a little more about programmatic KPIs. So tonight is really about the strategic plan in that space. And so you guys are all right, I'll hand it over to y'all.
Awesome. Well, I'm going to kick things off, but I'm going to quickly turn it over to my lovely colleagues who are taking on the bulk of the presentation tonight. But nice to see you all again. And I know I'm very familiar with our other board members. Steve or Steven? Either way. All right, Steven. Go with the word. Steven, it's nice to meet you tonight. And we're obviously, our team is selfishly very excited given your background, since we are the data evaluation planning related team. So we're really excited to have your expertise on the board. I'm just taking us off. As Kelly said, our focus tonight is really on the progress that our team, our strategic priority leads, our strategic priority work groups have made over the last 3, 4, 5 months in formalizing, finalizing our indicators for our strategic priority goals and objectives. To tee us off, though, I just kind of wanted to give a high-level overview of kind of the breadth of data work that our team has been involved in, currently involved in, and has been moving forward throughout this entire year. So again, with regards to our strategic plan, there are some ongoing pieces, as the board is familiar with, namely our quarterly reporting. We're doing those regular report outs on progress associated with the strategic plan. But tonight, as we said, we're very excited to dive into the more quantitative pieces of evaluating and monitoring progress of our strategic plan. One of our related data projects that we're very excited about and moving forward on is this annual BCPH staff survey, which is one way in which we will be evaluating some of our strategic priorities. And this is something new. There was previously a survey in place prior to the pandemic, but as Kelly alluded to, this is something that we're interested in reinvigorating and having implementing on an ongoing basis. Next month, we are very excited to dive into this programmatic key performance indicators conversation. So working with programs across the department in formalizing those, bring those together, having the tools, systems, data visualization platforms in place to have those data available in a timely manner for programs, for senior leadership, for the board. Kind of related to that is this ongoing dashboarding webpage project that we were working closely with our comms team and IT team and actually county IT to stand up. And kind of goes without saying, but throughout all of this, our team is very excited to be able, one of our favorite jobs really is to be able to provide that programmatic planning, evaluation, and data support. So while we haven't got to do quite as much of that this year as we might like, that is still an ongoing piece of work that we're involved in. We have several evaluation projects open right now. We have a big planning project that we have open right now. So that's just kind of to set the stage of kind of all of the data modernization, data infrastructure projects we have going on. So with that, I will turn it over to Rachel to dive into the strategic priority indicator.
Thank you, Elise. Apologies, I know you guys are like to the side of us. Trying to talk to everyone and you guys. Okay, so I'm going to start by just kind of talking about like an overview of our timeline and the process, some of the steps that we went through with this project so far. There are some more detailed slides in the packet, in your Board of Health packet, if you want some more information on kind of the process that we went through. So we really dove into this project in March, and we did not start from scratch. So I guess taking a step back, the purpose of us kind of diving into this project was to review and refine the indicators and the measures of progress for our strategic plan. So when I said we didn't start from scratch, meaning when we developed logic models last year, the priority leads identified measures as part of that logic model process. So as the HPE team, we reviewed those measures, made a few suggestions for maybe some new measures, new indicators, to really make sure that we are measuring the work that we set out to accomplish in our strategic plan. So again, started that in March. That kind of continued on. This is a very collaborative project. So while we did an initial pass, we then met with our priority leads to go through the indicators, to go through our suggestions, and kind of that back and forth feedback process to make sure that they were comfortable with some of the indicators, and some work groups were trickier than others to really try and identify how we're going to measure our work. It's not perfect yet, but we're going to keep working on that. So we also wanted to build in time in this process for our priority leads to go back to their work groups and talk with the people who are implementing the work, again, to make this a collaborative process. That's kind of the springtime into early summer, April, May, June. We had our indicators finalized with the priority leads in June. In July, we met with the director's team and reviewed all those indicators and got feedback from them, incorporated that feedback, and that's where we are at today. So also in your Board of Health packet, you had kind of the lengthier document that had all the indicators for all of our strategic priorities. And so that's what we're moving forward with for this year. Like I said, it's not perfect. We will continue to adapt as the work changes. We might need to change some of the indicators as we continue learning from the data that we're collecting. So that's kind of an overview of where we started up to where we are now. Then I'll turn it over to Eleanor to talk a little bit more about the indicators.
So as Rachel said, you have lots of nitty-gritty detail in the packets themselves, but to just give you some broad strokes description of this work. For each strategic priority, we've identified one or more goal level indicators to help set the stage and provide context for the strategies that are being emphasized in each strategic priority or by each priority work group. So some of the goal level indicators provide snapshots of the public health issues that are motivating the work. Those indicators report on recognized population health measures. Other goal level indicators summarize existing data about current agency efforts in the strategic priority work areas. Overall, with the goal level indicators, we're taking advantage of existing data from external entities to begin painting the picture or telling the story of why the priorities and the objectives are important to work on. The main purpose of this whole data project, though, is to monitor BCPH's internal process within each strategic priority work area. And it's really our objective level indicators that are going to help with that. So those indicators can be thought of as objective level KPIs
or in some cases, documentation of key steps towards achieving each objective. So monitoring those indicators is going to involve primary data collection using a variety of data sources, and we'll summarize those data sources in a moment. The largely quantitative data that we're going to be collecting with the objective level indicators is going to complement the quarterly, but generally more qualitative reporting that's already being done on the strategic plan. And together, those qualitative and quantitative elements should provide a more complete understanding of how BCH or BCPH specific activities, programs, and partners are working together to advance the agency's strategic priorities. So here we have a very high level overview of where data for the objective level indicators will be coming from. We are going to be able to report on some of the indicators this year. For instance, HPE plans to roll out the annual staff survey that was mentioned a moment ago this fall, and that will provide data on approximately 18 strategic priority indicators across 4 of the strategic priorities. Data on program participant, training or event attendance, social media analytics, partnerships, policy and planning activities, and more are also going to be sourced from internal records. And some of those data are going to be available in 2025. However, other data won't be available until we build additional data collection tools and processes and reporting systems. As examples of those, some new surveys are being suggested, including short ones with community partners and also with clients who are using one-touch BCPH services. Some existing services, or excuse me, some existing surveys may also need some new questions added so that we can have consistent enough data to roll up to the multi-program objective level. So throughout this process, HPE has already started and is going to continue working with relevant programs to get their buy-in and their support for those new surveys, those new questions, and the new documentation processes, because it really is going to take change on multiple levels, program as well as agency level. As much as possible, we are also hoping that this work goes hand in hand with our separate but complementary programmatic KPI data project that we will be talking about next week or next month.
Not next week.
Not next month, next month.
Give you all
Back
three.
to Rachel. All right, so back to the timeline. Now we're going to talk about moving forward. So how are we going to kind of round out the rest of this year with this particular project? As Eleanor mentioned, some of the data will be collected and reported on for 2025. So what we are going to be working on with the priority leads is reviewing those indicators and identifying which ones are feasible to get data on this year. And then starting to either identify processes that are already in place that they use to collect that data or building new processes for this year. Along with that, we'll start developing our data management system and our data management tools that we're going to be using to kind of build that infrastructure. We are planning to collect the data for 2025 in November and December. As it's mentioned, the annual staff survey is going to be a piece of that data collection right now planned for November, tentatively. Once we complete the data collection, we will compile everything, visualize everything, figure out how we can use that data to kind of tell the story of our progress so far. That will be reported out in the Q4 report. And we'll also be using that data at our annual strategic plan review to help kind of inform our discussions and any changes that we want to make for 2026. So that's kind of our plan for the rest of this year and early into next year. And once we wrap that up, we'll start figuring out the processes for the remaining indicators that we didn't collect for this year, continuing to build on those processes.
Just a quick question. Do you guys have a sense of what percentage of these indicators you do have data for that will show up in the Q4 report versus later?
I don't have the answer to that. Okay. We are just starting. We're going to be meeting this week actually to talk about kind of our first pass of what we think might be feasible for 2025, but haven't started those conversations with the priority leads. And it really depends priority by priority. So back slide.
Yeah.
So if you kind of look at
sustainability, transparency, and stewardship. Most of the data is coming from internal records and staff survey. So again, depending on the internal records, if that's easily accessible for us to get this year, then STS might have a decent amount of data. HRE, community engagement, kind of have those internal pieces, so those might be a little bit more of the data.
Right. I don't at the moment have a specific percentage. I think we can be confident we'll have at least a quarter of them. It's just based on, the number that are going to be collected in annual staff survey, which assuming that moves forward as we plan, will be there. And then, as Rachel said, certainly some of the internal record ones will be available, but it is very varied by strategic priority. And then we have a small number of secondary data ones which are readily available, and we'll pull those. But whether it's truly a quarter or it's more than that, right? That's a little bit TBD.
I think it's safe to say that for some of our strategic priorities that are a little bit further along and more reliant on existing systems in place, those should be easier. I think we acknowledge that within the MDH space, climate action and justice, HRE, community engagement, some of those are much more in flux due to the current climate. And so we are also trying to be adaptive and flexible, based on kind of direction that is given in those spaces. But I would agree with what they shared. Yeah.
And I will say with community engagement in particular, that's probably going to be a fairly low area this year because the program surveys generally are the surveys with partners, which is we feel is a really valuable direction to go in, but that's not going to be set up in 2025. And then even the internal records component, a lot of that is work that Megan is on board to do. And she hasn't been given that time yet to complete it. We need to give her some opportunity.
We can report back once we have a better idea. If that's helpful, we can share that back out, at least in the director's report.
Yeah, I think that would be helpful. And I know we're going to kind of merge this into the subcommittee conversation too, and maybe there can be more transparency in the subcommittee as well. Yeah. Kelly, I feel like you had your hand up and then.
Yeah, no, I think they kind of answered it a little bit. Thank you for noticing. Yeah, I think it's a good idea to look at, do we have priorities that we want to maybe collect some data on that? So I think that discussion is still out there a bit, right? Because we did talk about, what are some of the, with next month, we talk about rolling up KPIs across the programs. How do these, they're not siloed spaces, right? They blend with each other with all these data spaces. But at least really I said what I was going to say is that some programs have a great job and they have really good information and they collect on a regular basis. And others really need support and work and maybe some hand holding to walk that through, because they have to be on board with information that they're going to collect and how they're going to use that, right? So some of that is really working with those other programs to understand what is it that makes most sense, and that they can really roll up without, us saying, you need to collect that. It's a conversation with them, how we do that.
How many years you've been doing this annual survey, and like what types of questions are it?
So not been doing it.
So this team is relatively new. So there has been an HP team previously, and prior, I'll actually defer to some of the folks here. So prior to the pandemic, there was at least one HB survey that was implemented, but I think maybe only one. Does that resonate with your understanding?
Oh, there might have been two.
Maybe two.
Yeah.
So the county does an employee satisfaction survey.
Yeah.
And then I think we ran a couple surveys on the off year because it's every other year.
Yeah.
So I know that we did a specific survey on when we used the bar high.
Yeah.
Which is looking at health equity. We use that survey to help launch our health and racial equity work. So we have had a series of surveys, but this will be the first one we've done in a long time. And I went through the process with the team, and they've done a really good job on figuring out and identifying which questions are, what are measures that we can look at where we don't have to ask questions, but then what are those questions that are perception questions that we need to really hear from the staff? And so I think it's going to be a really good survey. I'm excited about it.
I will say, so to answer your question, this is somewhat new. And definitely the content will be new for the agency, but we have definitely tried to, Indira's point, be intentional of what are we capturing here versus what can we get from the county's engagement survey? What can we get from Bar High or GARE, thank you, the GARE survey. Trying to, be strategic, and
Compliment.
the intention is for this to be an annual thing, whereas in the past it was biannual every 2 years. But I think the intent is so that we can have regularly accessible data that we can at least report out on annually to have that more consistent. So,
And complement the biannual county level things.
yes,
Yeah, like the GARE survey, which is the Government Alliance on Racial Equity. They do a really good job about asking some key questions on health and racial equity, and is your leadership doing it? But what they don't ask are questions on inclusion, right? Do you feel included working in this? And that's really important, right? Because we talk about diversity, equity, and inclusion, but they're not measuring the inclusion goal. We know that staff satisfaction is often related to inclusion, and so there's opportunity for us here to kind of complement the GARE surveys, bringing and add to it our own kind of needs as an agency.
GARE is very racial equity focused, and which is obviously an important part of equity work, but there's been conversation of, if we wanted to collect data on things beyond racial equity, our staff survey might be another great space to collect. So
in the intersections with sexual orientation and gender identity, and all of that is really important.
Clearly, we have lots of thoughts on this, but sorry, we'll let you get back to the presentation.
Could I ask a question?
Yeah.
And apologize if this is something that I'm very naive about. So program surveys, you mentioned that these are the surveys that partners are often carrying out on behalf, or I guess I heard something, but I'm not sure.
Well, I'll turn it to you. I'm sorry. I'm not going to jump in.
That's a global mixed group there. Some of the program surveys that we're referring to, especially within the community engagement, are planned surveys that we'd like to send out to partners who are already working with our programs to get their feedback on the work. However, within that same column, some of them, for instance, under mental and behavioral health, are more surveys that are given to training participants to measure their skill acquisition and their satisfaction. Under STS, I believe the program survey there is a proposed essentially quick satisfaction survey for BCPH clients who are coming in for light touch services. This could be to request vital records or come into the immunization clinic where they're not part of an ongoing program, where we might have we'll have other surveys for them. So this is a very piecemeal column that incorporates pretty much any kind of survey work we'd be doing with participants or community members who are using services from BCPH or helping with planning and implementation.
And is that done annually, or what's the periodicity of that?
That's a great question. To be determined.
It varies. I mean, training surveys, some programs have them up and running and they conduct them immediately after the trainings. And some programs are interested in those and don't have them up and running. And that's one of HP's role is to help them do that. The partner surveys, for instance, that is still in planning stages. It's just an area of data that perspective that we think will be very valuable, but we don't have that system set up yet.
Yeah. That's the big lift. And to your question earlier about the partner survey, that is one specific to our community engagement work, assessing that work. And to Eleanor's point, there's lots of thoughts about, there's been a lot of discussion of how that would be really valuable. Getting that set up correctly, administering correctly, knowing who we want to be engaging with that, I think is something we're very excited to have Megan Gatos on board now, because that is definitely an area that our team is excited to dive into with her, of getting that off the ground.
And interestingly enough, it's not just within the community engagement, actually the climate action and justice and the EPRR, the emergency preparedness, response and recovery, because certain objectives within those strategic priorities are very much about how programs are engaging with the community, with community partners. Some of those are community partner surveys as well.
So would you say it's a mix of sort of process indicators and impact indicators also in there?
Yes. With trying to get as much as possible towards the impact and the outcomes, even though some of it is perception.
Yeah.
Like where we're probably going to start with the partner is going to be, what are their feelings about how much is being accomplished? And are they satisfied? Do they have the information they need from BCPH to continue their work effectively? So I would say some of it is still subjective, but we are trying to get to impact. Yeah.
That was gonna, just as a follow-on question, sorry, guys. Related to that is, do you have a sense as we kind of round into the fourth quarter and what we produced to that point, how much of that is impact indicators versus to use vernacular versus process indicators?
That would be another one, a good one to follow up on based on your other one. We can look at, because we shared with you the list, and we can kind of go back through and kind of do that.
Yeah.
On the back of the napkin, or we can do a more in-depth evaluation of kind of what we have. But do you have initial thoughts, or?
Well, if you look in the worksheets, I don't have numbers, but in the worksheets, we have tried to have some guiding evaluation questions. And certain questions are focused more on those process, like what are we doing? Let's just document some of the actions. Some of the other evaluation questions are trying to get at the outcomes, recognizing that those are both important.
Yeah.
I would say we have more consistent indicators for that first type of evaluation question than we do for the second, but that is our goal.
Yeah.
And it's laid out a little more clearly, I think, in the worksheets, if you feel like getting to into that level of detail. I think I have one more slide.
We're over our allotment.
Okay, so this is kind of a segue from today into next month's presentations. We've talked about the related but different strategic plan indicators, as well as the programmatic KPIs. So one way to kind of frame this is in the annual report that was, I think, presented to you guys last month with Sean and Kelly. Last month.
Yeah, it was last month.
Okay. So in that annual report, there were key areas of work that were outlined. So the strategic plan really prioritizes work within 6 of those work areas. That's what we talked about today, were the indicators of how we're going to measure progress. Those next month, we'll be talking about the programmatic KPIs, which will touch on more of the agency-wide works of all of the key work areas. Kind of that more holistic view of how we can evaluate our work. So that is the teaser for next month. We'll be back to talk more about indicators.
Thank you. Are there any other questions, or I know we're at
Time check, if there are any other questions.
we're happy to answer questions offline.
I like the idea of a teaser. That's.
Yeah. I just see. Do you have any questions? I want to make sure you have an opportunity to chime in.
Thank you. Yes.
We can, are you guys good? Can we move to the next topic? Okay.
Thank you.
Thank you.
All right, well, the next topic ties nicely into this one. We're going to talk a little bit about an idea that's kind of been floating around for a while, around possibly creating a strategic planning subcommittee. And I'll just start by saying that's not the only option, but there, see teaser, right?
Yeah.
Great. So the background of this proposal is that we understand the board's role in 3 primary areas: budget oversight, executive director oversight, and really approval about the agency vision and the high-level strategy work. And I think that part of the reason why this topic is coming up as a question around a subcommittee is because of some of the success we've had with some of our other subcommittees, as well as there are some external factors that are at play here, as well as some internal ones that create a real rationale for creating some kind of way for the board to focus in on this work a little bit more other than the appreciated but somewhat sporadic presentations from the HPE team specifically about our strategic priorities. One is really about this kind of continued changing national landscape and budgets that is going to require flexibility and an ability to pivot that isn't super friendly to 5-year strategic plans. And so I think we're going to have to be able to figure out how do we navigate that together. A second point is that this is a relatively new leadership team that has a pretty strong vision. Armando joined us a year ago, and Indira was the year before that, and I think I was the year before that. So we're all pretty fresh. And Kelly's been here a little bit longer.
That was the year before you,
Oh, but you weren't in your position.
until the year.
That's right.
Yeah.
And it feels like we've been working really hard with our management team on building this agency vision, and it feels like it's starting to come together in a way that I think is new for the agency. And I think it's something that we can capitalize on. We have also recognized that there are some really significant needs to strengthen our agency infrastructure and support change management through this process, and those can be tricky charges in times of low resources. And we also, we need you as our board to really have enough knowledge and be passionate enough about the work and have enough depth in it to be able to publicly communicate and advocate for this vision that we're working on. Next slide. So this is a beautiful vision, beautiful visual that Armando developed at a different agency, and we adapted it for us. And we just wanted to kind of do a little level setting on kind of how we see the balance of work between the board and the staff. Because first of all, the expectation is not that all of a sudden the board is, working on the ground with staff on a strategic plan. That's not what we're trying to do. But really just to kind of show how, the balance of emphasis and decision-making shifts as you get closer and closer to the ground with the folks that are doing the work. And so this is just a proposed idea of the Board of Health roles and staff roles in different spaces. And certainly something we can discuss, but we just kind of wanted to share it with you as a way to think about what this work looks like from a board member's perspective in terms of your role. So, the highest level, it's about purpose and vision. Certainly the board needs to have a strong voice in that. Strategic goals too. And then we start to get into things like strategic priorities because we're getting more and more into kind of operations, into subject matter expertise, into what's feasible to accomplish, what do we have the bandwidth to do. And so that balance shifts as you go deeper into the day-to-day work. Any questions so far? Okay, next slide. Okay, so the scope of what we mean by high-level agency strategy really is creating agreement with leadership on strategic vision and any significant shifts in direction or approach. And just to give you some examples, we would want feedback on initiatives related to the strategic vision, such as our agency goals and strategic priorities, our local policy and systems change strategies and priorities at the local level to strengthen public health prevention. So that's not a specific part of our strategic priorities, but it's a really important aspect of what how our agency is trying to create community change, how we're trying to really have a positive health impact on our community. The work of our health equity and community engagement strategies. What do those look like? What is it that there's a dozen, 2 dozen, 3 dozen different approaches to do that kind of work. Here's why we're proposing this kind of specific approach, why it fits our community, why it fits our agency, why it fits the relationships that we have. Strategic communications. We do an amazing job with communications, and I know our team is looking at new ways of doing some things, and having that planning piece tie into the broader agency strategy is just going to make us a stronger agency and able to really affect more change. Having conversations about data and evaluation system expectations and projects and products. We want the board to have early conversations with us so that you are telling us what you're looking for and how we're presenting data. And then it's our job to go and figure out how to make that happen. And then finally, investments in infrastructure and support for change management. Those are sometimes in the weeds conversation, but it's really important for you to understand the work that we're doing in those spaces, because it's often related to how do we build agency commitment across all of our staff? How are we communicating with them? Where are we seeing challenges, either technical challenges or culture challenges? And that is, part of this question of, is your strategy going to work, right? Culture eats strategy for breakfast. We all know that one. So these are just a few of the areas where I could see this kind of a group providing feedback and input and consultative support to us. And so I'm curious if there are things that stand out to you, if you have questions, what feels compelling.
So my initial reaction to this is just trying to distinguish between the board role and the not board role. And just being respectful of board members' time and energy, right? And like we're really focusing our attention. This seems like a very large remit. And what I worry about is like, at what level, what altitude are we flying, and how are we really getting into the programmatic details or not? I feel like that's not a good place for the board to be.
Agreed.
Yeah. Yeah.
Can you go back a couple,
Back to
one
that flight
slide?
analysis so they can see where the responsibility is. They try to make it to,
Yeah.
Then one more. Airplane.
Oh, sorry.
if you look at the purple and blue at the bottom, see at the purpose and vision, the board is really heavily involved with that, right? That purpose and vision. Where do you see the board going? And as you continue to go down to the runway, it gets smaller. And that's where it really hits more of the staffing, the operations that really Lexi is moving towards guiding. And that's where the operations. So you don't see that much of that purple, right? The board involvement. You don't want to be in the weeds. You want to make sure that you're advising, directing, recommending. So it's that 50, 40, 30 feet.
So for instance, you mentioned programs and projects. And if you look at the Board of Health role in relation to that 10,000 foot example, that would be really about us being able to tell you the evaluation outcomes of our programs and projects, not about you planning them or anything like that. It would really be just, we want to be able to be transparent about how our programs and projects are doing. And for you to be able to consult with us.
So that would potentially be a roll-up KPI dashboard for the board.
Exactly.
Correct. Feedback more.
Yeah, I think my kind of reaction immediately is if we could be more specific on this, like I think that would really help, right? So we're better defining the remit of the subcommittee and what maybe tangibly the work products are that would be evaluated and come out of that subcommittee. I think so. Stratcoms for me, I'm like, I don't know what that means, right? Like, what is that, right? And where does the board play a role in that? I think so maybe just a little click down further would help define, again, what the subcommittee is really doing in that way. But I appreciate
It's a brainstorm.
yeah. But I appreciate the engagement around this, right? And it's just, I think, more of like the definition of just what is board level.
Yeah, and I mean, boards really do it differently too. And to some extent, you know, this is for us to figure out together.
Yeah. And that could be part of a subcommittee's work.
Exactly.
Yeah.
Okay,
It would be like working with this subcommittee.
I'm sorry.
Who on the department side would be working with the subcommittee?
Sorry.
So I mean, I think as the ED, I would always be there. I think Kelly would be there a lot as the strategic initiatives director. I think our HPE team would be there sometimes. I mean, it kind of depends on what the agenda for the day is. If it's about communications, then we might want the comms team there. I don't know. I think that's another thing that we have to discuss is like, what's the constitution of it? But we'll get there in a sec.
Again, I apologize if I'm jumping in.
You must not, you must not.
Okay.
You have
I just have just a question. So, the role of board as it's described here, affirm vision and purpose. Is this something that you as executive director and your team put together and then we review and say that looks good, or is it up to board to come up with that vision and purpose? I'm just trying to understand sort of where does the I don't know what the right word is. Do you know what I'm saying?
So, I mean, I think when you go up to 50,000 feet, you're gonna be, steering a big ship. You're not gonna be building a ship. You're gonna be steering a ship that's already in the water. And to use another transportation metaphor. But it's, you know, Boulder County Public Health has a pretty strong and somewhat distinctive vision, and it gets shaped, right? It gets shaped by leadership. It gets shaped by community need. It gets shaped by opportunity and skills and resources. All of those things shape our vision. And so I think it's really a matter of understanding where is the shaping happening, and is that turn to the left, turn to the right? Well, not politically, but is that navigation going in the direction that makes sense to the board? Does that help?
Can I add something?
Sure.
So last year, we did a roles and responsibilities of all the members of management team and what each person does. We also included the Board of Health in there. And so within the Board of Health, most of the roles and responsibilities are fiduciary, right? Oversights. And I think this is an opportunity to maybe expand what that role and responsibility, but I think it needs to be done together to scope it so that you're not being overwhelmed and figuring out what part of that 50,000 foot vision and purpose, in addition to the budgetary financial responsibilities, do you want to have a say or be able to consult with?
And Steve, just to share with you, would be relating back to our oversight of the executive director, we did as a board talk about what we think their priorities are mandated as a board. And so what was listed earlier is pretty consistent with what we agreed to as a board. And I think the other thing that's related to this, and that was something I was actually going to raise as well, is can't really have this conversation without the budget. So if we're fiduciaries, right, in this context, then our strategy has to align with what our budget allows us to do fundamentally. And especially in this environment, obviously, where we need to be prioritizing our resources. So I think those things kind of go hand in glove. And I would see those two subcommittees in whatever form they come out from the board discussion would need to be aligned. And obviously having Armando there to support both conversations is really important.
Yeah, because there are the critical things that we have to do, the mandated required work that we have to do. But what we might need to think about is the innovative spaces. And how do we fundraise for those innovative spaces? I mean, some of our major strategic priorities are just not getting funding under this current administration. So that might be an area where the board could be very thoughtful in helping to think through how to scope that work and how to think, through it to do it with the limited resources that we have.
I think Kelly wanted to say something too.
I do, thank you. Over the last year, we were doing priority-based budgeting, right? And we getting our budgeting in a place that makes us more sustainable. That was a huge cultural shift and lift for this organization. So is this, right? This is something that, it's not like we haven't done some of this work in the past, but we really haven't as an agency pulled all these strategic spaces together, looking at data, looking at broader strategy, using data to make decisions, tying it into what we've done with the budget work. And so I feel, right, that part of that is not going into the weeds of all those things, but being all on the same page, right, with the cultural shift that's being made, that the board is shifting that space with the staff, hearing from the staff, you all being able to provide feedback to us as we make that. I think that at the higher level, but I think that is important for us to be, because this is going to be another huge shift, this end of this year and next. So I think that's important that we're all in step with that space. And I think that's why the group that we form will be super helpful to do that.
Steven, I just want to clarify on the 50. So I would say to your question, or to answer it, is it's really your vision and purpose from the board that goes right to Lexi. That's why you see more of the purple. And so it really is working with, the board itself, saying, what do you want to see us? What's the vision for the agency? And then ultimately Lexi is executing it and making sure that we're executing your vision and your purpose.
So I guess my thought on that is that, Lexi obviously and the team are always have your finger on the pulse of what's going on.
Correct.
And as somebody mentioned, in these days with the way the federal government, the budgeting whole process, things are rapidly changing. And I just wonder, as a board member, we are several levels removed, obviously, from both of those things, right? Like what's happening and then what's about to happen through the budget chain. And I guess I'm a little bit concerned whether we would have the sufficient, unless we're down in the weed, the knowledge to guide the whole process. Because what we assume at this, we talk about it, but in reality, maybe something very different as you carry out your program. So I'm just trying to understand that intersection where the touch points are.
So when you're talking about the 50, that purpose and that vision, it's long-term. You're looking at that bold vision, right? And so it doesn't really affect the day-to-day operations, right? It's more that looking for the bold vision of where you want to be, that 5-year, that 3-year. So it can be very aspirational, right? Your vision can be, we're going to be this agency that's going to be forthcoming, innovative, and come up with all these programs. So that's why it's not so concerning as far as what the environment is happening right now with like the federal funding and state. That's where we report, on a monthly basis, for example, financials. I get you financials every month. So you'll get a red flag knowing that, hey, we have some issues. Let's talk about it. Let's get into the subcommittee, and then I can have those difficult conversations. So we have controls in place, so we don't have to react. We're trying to be very proactive. And so when you're looking at that 50 and 40, it's really that high level bold, where do you want us to see it's bold? And we have to figure out how to do the day-to-day projects to get there. And so that's why I don't want you to be too concerned. It's like we have controls in place at the, the 20, the 10, and the smaller, so that way we know what's going on. We red flag things and we bring it up to the board. And then the other thing is that I want to talk about this 50 is with all the change that we've done with priority-based budgeting. Lexi's brought it up. It's like we're going to have to make some adjustments to that vision. And I think Lynn just said that also. It's like we can't afford everything, so we're going to have to make some changes to our vision, our purpose, and our goals. So we're gonna have to realign, I think, and I think Kelly's group is gonna have to work to say, what is important to this agency and how do we adjust?
Yeah, and in my work with strategic planning, that vision and purposing kind of work helps with, driving the execution against that. It's also really important from a communications perspective, right? So as we think about stakeholder engagement, internal engagement, when I've done this work, you actually put your vision on the walls, right? Like it should be aspirational but achievable, meaning people understand, like, this is what we're trying to go for. And I also appreciate the comment, this is not a one-year view. This is usually a multi-year view, but you also want to be realistic about how far you go. Like,
Yeah, 3 years, anything more than.
support, but 3, maybe, this environment, maybe 2, but like, it's just, getting kind of clear on like more of an aspiration, right, of what we would like to achieve, but also acknowledging the restraints that we have. Yeah.
I think a lot of times the vision also articulates how the agency perceives itself and the community and that relationship. And that may be quite steadfast.
And I was going to mention as well, I think it's as a bit to Steve's concerns about, what altitude we fly and how we can impact this discussion. I think as a board, it would be helpful to get additional, and I know we're working on this right now, community insights, right? So it's not just the board as board members making these recommendations, but that we actually are ingesting survey work from the community or whatever that looks like. So, and I don't think that's something we've really done as a board yet, at least since I've been on the board. So.
Yeah. Okay. We good to move forward one more? All right. So go forward one more. There you go. Anticipated value. So these were just kind of some of our brainstorms about what would be the value of this. Having clear and agreed roles, responsibilities, and expectations. Really being able to orient the board to our current vision, our tools and approaches, and the work that we've done to date. Making sure that our goals are aligned with our investments. Having agreed agency-wide goals, strategic priorities, and frameworks. So kind of the architecture of it. Delivering data and evaluation information for decision-making and communication. Stronger understanding of the relationship between strategy and the evidence-based. Stronger understanding of workforce capacity and feasibility. And I think that's a really important one because we can have, all the aspirational vision and goals that we want. And if we can't pull it off because we just don't have the resources, then that's going to be really important for us to reconcile, to have those clear expectations. And then also, I think kind of forward looking, the ability to better anticipate future challenges and changes. Right, so I'll give you an example on the next slide. I'll give you an example of how we have worked on the budget last year.
Sorry, one thing I would just add to that list, because I've been thinking about this, is I think this community engagement piece is key to this as well. So I would just add that as a value. I think it will strengthen the board's role with the community.
That's great. Absolutely. Okay. Right. So last year, so historically, our board has used a budget study session a couple of times a year, which brings together the full board. It's comprehensive, it's high-level updates and proposals moving forward. The board's role is consultative. It's usually 2 to 3 hours, and it's a public meeting without comments. And in this last year, because we felt like the budget was something that we really needed to get a hold of and dig into, and that we wanted to be really in lockstep with the board, we created a subcommittee. Subcommittees can have 2 members max because you can't have a quorum. The board role is again consultative, but we were doing for the budget subcommittee, it was 1 hour a month. It's an internal meeting. It's not open to the public. And it provided an opportunity for more frequent updates on progress and for staff and board questions and deeper discussions than was really appropriate for a public meeting. That model worked really well for that particular challenge. I think for the strategic work of the board, the strategic visioning work of the board, that I would say, there are really three opportunities. There's kind of the regular Board of Health meetings, there's study sessions, and there's we could create a subcommittee. And so these are like some of the questions that I would ask you. How you would want to go forward. Does the full board want to participate in study sessions or have regular updates in the meetings? If we had a subcommittee, what would be the right meeting frequency? Would it be heavier at first? You want to choose priorities? If we did that, we would need to, have questions about the membership, the expected longevity of the committee, et cetera. So, I think there are lots of questions, but I wanted to throw out some options for you all to think about. And we don't have to, make hard decisions tonight, certainly, but I think, hearing you talk about kind of what you're interested in and what you think would be needed will really help us to focus in on a proposal that could meet the needs.
I think this conversation is great. I think we've sort of loosely talked about more getting more involved in the strategic plan and possibly having subcommittees. I've been around just a couple of years now. So I can tell that if it's something that keeps resurfacing, it's something I think that the department probably prioritizes out of the board's engagements. For that reason, I think that happy to hear what this could look like. I've enjoyed participating in the subcommittee this past year. I did the executive performance one this past year, and I thought it was very helpful for me as a board member to stay in tune. And I thought we had success, as a subcommittee. I think my question would be, there is 5 of us, right? And if there are 3 subcommittees, what does that look like? And so I think maybe as a board, we need to talk about the frequency. If the budget subcommittee moves to quarterly or if the executive performance moves to quarterly, then I think that probably opens up more options. And if this is the priority for them, you're concerned. If we would prioritize this as a monthly meeting, then
Yeah, I agree. I think I totally agree with what you're saying, which is I think this is important. I think it's a structure that's worked really well for these 2 other areas. I think it's a capacity question ultimately for the board, and maybe procedurally, Lexi, one thing that I do stepping into my new role is get the pulse from board members in terms of how we want to think about the 3 subcommittees and any changes we'd like to make. I don't know what's appropriate, whether we do that in an executive session, we could do that individually, or we could do it in a public meeting. You guys maybe advise me on the best approach, but yeah, those puzzle pieces can then come together for us, and then we can make decisions about how to appropriately structure, and also where we put the incredible talents of this team, including our newest member.
Oh, yeah.
So it feels like we want to kind of collaborate a little bit on this holistically, but I support what Amber's saying in terms of the need. I think it's coming from staff as much as it's coming from the board. So yeah, it leaves me and are in the face.
Can I just add one thing? This has been really helpful also selfishly, since our team will be involved in some way, shape or form. And I think to your point, Lindy, it might be interesting for the board to think through which are the pieces of this that make sense for the subcommittee versus the things that you do want regularly coming to the full board. So I was thinking about we talked, next month we'll be talking about programmatic KPIs. Are there pieces of that you would like the whole board to be involved in? So we just make it a regular practice in the regular board meetings versus the pieces that feel more valuable there, because we are happy to be flexible and adaptive, just helpful to know what the scope is for these meetings versus what you would like to get out of the subcommittee. So, yeah.
So one suggestion might be to the board is, I can work with each of you individually, maybe just to kind of get your input and insights into what you think the right path might look like. And then we can put together a straw man for the board then to collectively react to finalize. And again, I'll need some guidance on what needs to be public in that discussion versus not.
That's great. Yeah, we can check in with, I think Erica Rogers is on the line and she is one of our attorneys at County Attorney's Office. So I'm sure that she and Kate can provide some guidance. Best way to have those conversations.
Because this is a very procedural conversation. It's not a decision-making conversation. So hopefully we have some latitude to, yeah. Will we continue the cadence of having budget study sessions?
Yeah, I think that's part of the conversation. I think that's,
If I may, I think a true, like a normal, a normal year that you do budgeting, you do one budget session or study session. That's all you need. We'll get to the end of the year. It's more of a retreat understanding, a financial update, and then you do a budget retreat for the year, for the coming year. That's it. So this year it's been slightly different because we've had to, have some direction from the board and we've had a lot of information. So that's why we've had, more than one, but in a normal year, we should be having one a year. We talk about it.
study session.
A study session.
Yeah.
And that would probably be the only thing that I would say.
Especially since you've put a lot of those monthly reports into play, and we're really, I feel like there is a lot of transparency and accountability, and hopefully it feels better.
I mean, we instituted this subcommittee as a way to stay in closer contact with the board so that we could be responsive quickly if there were questions or concerns.
And it was a very rapidly moving environment. Hold on.
And so I do think, I think it's completely appropriate to question whether you still feel like that level of urgency is needed. Would you like to move to a quarterly tempo of budget discussions? We could bring them back into the full board meetings, or we could keep them offline with a small group, whatever you guys decided.
I'd like to throw my team a curveball over there and maybe Lexi.
Let's have some fun.
Yeah, no, it's, at the end of the day, why not get it figured out or whatever? But, I think we need to take time to make the decisions and figure out what works out. And I understand, the capacity issue work, that's really important. I do feel, we went through some of these, we've had conversations with Lexi and my, the team and things like that. And gee, what does this look like? And, different hurdles and things. I feel that we are at a bit of a crossroads at the moment about moving some significant work forward or not moving it forward. And it would be, even if we don't form this group, might be interesting to connect with a few of you all just to get sort of an impression of what some of that looks like. And I know we're going to be doing some of that. We did some of it today. We did some of that in October. We're going to be doing some of that in October, but I think there's opportunity in that space. So I don't, from my perspective, I don't want to lay this off until next year or something like that, because that one, what has really been a major hurdle for us is doing work and then resetting and doing something different. And so getting that space would be super helpful. So I'm sorry if I made my team hate me or, whatever, but.
The other thing I would add is, just from my prior experience with strategic plans, is you probably want to do it towards the end of the year or the beginning of the year is where you meet more frequently. So you establish kind of the year plan, and then you can do it quarterly. But I would probably recommend, moving up to the beginning of the year, maybe like November, December, but you have holidays. We'd always do it at the beginning of the year, January, February, where we really met with the board, got, an idea of do we have to change that 50,000 feet vision, anything we have to change. And that way you give direction to Kelly's group. And then after that, it's more reporting, right? We build the infrastructure. Now it's just on a, quarterly basis. There's some reports, you're looking at dashboards. So just keep that in mind, because every month, if you're meeting, you want to make sure that you're adding value. And I think you can only add so much value, because then it becomes monitoring and reporting.
I really like that timing, Armando, because we are just coming through our priority-based budgeting. which is going to potentially change the direction of some things. And the federal budget, it hasn't passed yet. So we'll have a better sense towards the end of the year, what's actually going to be funded, what's not, and what's realistic, and what do we have to hold on to. And, so we'll have a much better sense at the end of the year. And I like that, starting off the new year with that pace.
And another organization will do a retreat. So like in February or January, we have a retreat that we focus on strategic planning.
Yeah.
And then I can come in with the finance and say, hey, we ended this year with, because I won't have financials, but I'll have projections to say, we have this much money coming in. How's it going to affect our programming? And then you give direction. And we already have the systems in place to build a strategic plan. And then that's when you really focus on giving, instead of wasting your time every week or every month to talk about, a strategy that it's constantly moving, give it to us up front. Let's work on it. Let's measure it and then report on it.
Yeah, I think it sounds it's very similar to the priority budget process where, there was like a lot of upfront engagement from the board, and then that set the stage. And then Kelly, I'm hearing you very clearly, like you feel strongly you need the board to engage right now. So I think that sounds great. So why don't we do this? I'll work with Lexi, you and the team on a straw man, right? That we can I can sort of talk to the board members about, get additional input. I think part of that will also be who wants to participate in what pieces of this overall, because I think we will do a refresh at a more global level in terms of where we're focusing our time. And then come back to the next board meeting, maybe we can finalize that model publicly. Does that make sense? Okay. If it doesn't,
Theoretically.
okay. Yeah, we'll discuss more.
Some timing issues. We'll have to-
Yeah. Timing may not make sense. So, okay.
But yes, absolutely.
So we'll continue to work on this. I think it's all interrelated, and it's also about time management for the board too. So, okay.
And believe me, the time management concerns that you have are shared.
I know.
I try to make the best use of time, any time.
Well, thanks, guys. This is a great conversation. Really appreciate it. Okay, where are we? What's happening?
Director's report.
Director's report. Okay, so thank you, Patrick. Are there any comments or questions on the director's report that's submitted to the board?
Specific questions, but it's always very helpful. I appreciate the time put into making it concise.
I will mention a couple of things, even that didn't make it into the director's report. We have some good news and some bad news. The bad news is we did hear from the state, the governor issued an executive order reducing funding to public health by $16 million. $3 million of that will hit LPHAs per capita and retail food and childcare grants. We think it'll probably be around $150,000. So we're taking that into account. And of course, we still have to get through the federal budget season. The twists and turns that brings with us. So that's what we'll be watching pretty closely over the next couple of months. The good news is that Safeway has COVID and flu shots. And I went and made my appointment today, and they have a lot of openings.
Okay. I'm going on Friday.
I got mine last week.
Friday afternoon is definitely mine.
And you don't need a prescription. You don't need a prescription.
We are starting to kick into respiratory season. So just really encourage folks to get your shots. We're really pleased to see the governor step in on the immunizations issue and protect access to COVID shots, which was really very helpful. And there were a couple of mentions in the upcoming events. We do have an all-staff retreat coming up in November. Would love to have the Board of Health attend. If you don't have the dates, we'll make sure they get to you. Not just attend, but participate. It would be wonderful to have you there.
Are there costumes this year?
You know, we're going to, so we had last year we had so we also have the Healthy Community Awards coming up, and I hope you'll put that date on your calendar too. This is an opportunity for us to honor community partners that we've just done some remarkable work with over the past year. Last year, those two events were combined and they happened to be on October 31st. So it was a very interesting, somewhat confusing day for some of our community partners, I'm sure. We actually have separate, they're going to be on two different dates this year. So, and I don't think either one is October 31st. So we'll save our costumes for work.
But if you want,
But you can, yeah.
You're always well costumed.
Okay. All right. Anything else on the director's report? All right, any old or new business or any announcements that we haven't covered? Hey. Aha. This is my most exciting meeting. There being no further business, this meeting is adjourned at 6:56 on Monday, September 8th. Thank you, everyone, for participating. Thank you, Patrick.
Bye.
Landry.
Bye.
Thanks, Landry. Feel better.
Thank you. I appreciate